Chapter 14, Part 2, Point of Care Testing and Special Procedures. Again, this goes over your chapter objectives that we will be covering in this class. The only thing that will not be covered in this PowerPoint is how to perform bleeding time tests. We will cover this in class. Introduction, terms used for laboratory service beyond the hospital setting. It could be referred to as point of care testing, decentralized laboratory testing, alternate site testing, near patient testing, patient focused testing, or bedside testing. The demand for point of care testing is increasing because the rapid turnaround time a laboratory test is necessary. Point of care instruments use a small amount of uncentrifuged blood specimen, and the use of skin puncture blood, urine, or saliva can also be utilized. This is really essential when we're looking to obtain a small amount of blood for patients that are hard to draw. Also, too, we might utilize point of care testing to preserve the veins for other uses. Frequently used point of care testing, I will have you review the slide on your own, but common ones we utilize in our lab is for glucose levels, influenza A and B, lipids, triglycerides. We can also perform these for electrolytes and blood gas analytes as well. This is an image of a glucose meter. Diabetes mellitus is a chronic disease in which the pancreas cannot produce enough insulin or cannot use the insulin that it does produce. Our second blank, insulin, causes the glucose to be absorbed from the body into the body tissues and then used for energy. Therefore, the lack of insulin in patients with diabetes mellitus leads to either an increased or decreased blood glucose level, depending upon what type of diabetes the patient has, either hypo or hypoglycemia. Glucose analyzers and meters, there's numerous and different types. We utilize 2 different versions in our lab. Safety and quality control procedures must be followed according to point-of-care glucose instruments. We will run quality controls on all our specimens with a new test strip package, or if it's done at the first of the month. Also, too, our glucose meters in the hospital run a quality control every 24 hours. This just gives you an idea of the glucose equipment and identification procedure we'd use. We're going to select the site and cleanse with isopropyl alcohol, especially the site of the finger. These next couple images gives you an idea. We're going to utilize again that 3rd and 4th finger. We're going to cleanse the skin with alcohol wipe and allow the skin to dry. Gently massage a finger a few times from base to tip to allow aid blood flow. Decide on which side of the finger to make the incision. Remove the safety lancet from the protective paper. Hold the patient's finger firmly with one hand and make a swift, deep puncture within the retractable safety puncture device. We're going to wipe the first drop of blood away with clean gauze and gently massage the finger from base to tip to obtain the needed drop of blood. And then you're going to either apply it to the test strip or the HemoQ microcuvette, as seen in the image above. The correct volume is drawn into the cuvette by capillary action. We're going to wipe off any excess blood with the side of the cuvette, and we're going to place it in the holder. We will have a detailed lab on both hemoglobin, capillary cholesterol, and capillary glucose point of care testing. This just, again, gives you an image of how to obtain that sample. We're going to discard the safety automatic lancet in a sharps container with biohazard label. Again, as we go back, discard the gauze, alcohol wipes, and gloves in biohazard waste container, and we're going to wash and sanitize your hands. Glucose analyzers, carefully read the package insert and user manuals, as every machine operates slightly different. Strictly follow daily quality control procedures. This is really essential because if the machine is reporting out abnormally high or low glucose levels, we could misdiagnose our patients. I'm going to have you review this slide on your own. Reproducibility of results, purchasing the reagent strips and controls in quantities to enable healthcare workers to use constant pools of the same lot number. really helps us because then we have the reproducibility of results, so being able to reproduce the results in order to improve our quality control. Preventative maintenance of each instrument is critical for accurate results. Routine cleaning of the point-of-care instruments. We're going to avoid the transmission of bloodborne pathogens by using a cleaning tissue with disinfectant, 5% bleach solution, or isopropyl alcohol. It's really essential we clean the instrument in between each patient use. Blood gas analysis involves the measurement of PO2, PCO2, and pH. Please be mindful that this is found on page 448 in your textbook. The PO2 and PCO2 are analyzed whenever a patient has heart or a lung disorder. The blood pH determines whether a blood is too acid or too alkaline. All these analytes must be closely monitored in emergency care situations, critical care units, cardiac intensive units, and it also immediate patient diagnosis and treatment. The PCO2 and PO2, again, are analyzed with patients that have heart or lung disorders. So it is essential that we keep a close eye on the blood gas analytes of these patients. Point of care instruments can also measure sodium, which is our first blank, potassium, chloride, or calcium. It also measures glucose, HCO3, TCO2. These electrolyte measurements are needed immediately in critical care situations. Measurements of troponin T to detect heart damage. Roche troponin T rapid analysis uses whole venous blood, heparin or EDTA. I will show you an image of this device in class. We also have the HemoQ. White blood cell count system has a point of care test system for determination white blood cell count for a patient. Point of care analyzer requires only 10 ULs of whole blood with a finger stick or venous EDTA sample. Blood coagulation monitoring, immediate results using controlling bleeding or clotting disorders in patients. The CoaguCheck XS system can be seen on page 449 in your textbook. This machine is utilized to monitor blood coagulation, prothrombin time with international normalized ratio. This also, too, is very beneficial because it only requires 8 microliters of whole blood, providing results in 1 minute. And this is to monitor patients on anticoagulant therapy. We also have hematocrit, HCT, packed cell volume, or PVC. HCT represents the volume of circulating blood that is occupied by a red blood cell. It is expressed as a percentage. Values are obtained to aid in diagnosis and evaluation of anemia. A less than normal number of erythrocytes may be used to evaluate blood volume and total red blood cell mass. Blood collection usually occurs by skin puncture. Hemoglobin is more accurate than hematocrit and a safer method to detect anemia. Using a fingerstick drop of blood, our total cholesterol values can be obtained, which is our blank. HDL cholesterol, LDL cholesterol, and triglycerides can be measured in 5 minutes. We will perform the detailed lab in class. Please remember, total cholesterol is a fat-like substance that occurs naturally in the body. So, when we talk about HDL, or high-density lipoprotein cholesterol, this is also referred to as our good cholesterol because increased blood values protect the patient from heart disease. Our LDL cholesterol, low-density lipoprotein cholesterol, is referred to as the bad cholesterol since high values are linked to heart disease. Triglycerides are fatty acids and glycerol that circulate in the blood and are also stored as body fat. Hemoglobin A1C to test for maintenance of blood glucose levels. These are also essential because it gives us a 3-window time frame of what the patient's glucose levels have been at. The Billy check for measuring bilirubin in newborns. Measurement is conducted through neonatal skin, so no blood collection is required. And the device is held against an infant's forehead and completes the test in 15 minutes. Rapid HIV point-of-care test is available for testing of saliva. And then the healthcare worker needs to know legal implications in the provision of this test, as you can see on page 451 in your textbook. That concludes Chapter 14, Part 2 of the Chapter 11, Chapter 14 PowerPoints. Please make sure to review the questions in the back of your textbook along with the case study.